Good morning, students. I am Dr. Maithili Patil. I am Assistant Professor, College of Physiotherapy. Today, we will be discussing about the assessment of sensations or the sensory assessment. So, in this topic, the objectives of this topic is the definition of sensory examination we need to see, then sensory tracts in the spinal cord, okay, then the dermatomes we need to say, and the sensory symptoms, okay, there are some sensory symptoms which will be there in our sensory system, and the rules of sensory examinations, how to assess the sensations. There are some set rules for the assessment of the sensory examinations to get an accurate knowledge or to get an accurate assessment from the sensory system or from the sensory examination. The next is the types of sensations. Okay, there are three types of sensations: exteroceptive sensations we will be seeing, then proprioceptive sensations we'll be seeing, and combined cortical sensations. And then for this sensory assessment, the kit we need to use and how to prepare that sensory assessment kit, that we will see. The objectives of the study: at the end of the lecture, the student should be able to understand the sensory tract system, the rules of sensory examinations, the exteroceptive sensory examination, proprioceptive sensory examination, and combined cortical sensations, and the how to prepare a sensory assessment kit. Now, what is meant by sensory assessment? Okay, in normal conditions, all sensations depends on the impulses arising through the adequate stimulations of end organs, or we call it as a receptors, and conveyed to the CNS through afferent or sensory nerve fibers. The sensory nerves, pathways, and sensory nerve distributions or system in the body, or we call it as a dermatomes. So this is the tract system in the spinal cord. Okay, there are some different spinal tracts which carries the different spinal or the different proprioceptive, cortical, or some exteroceptive sensations from the periphery towards the CNS. Okay, so these are some tracts which follows the same or which carries the same sensations from the external stimulus to the brain. Okay, and these are arranged in the gray matter of the spinal cord. Okay, we will be seeing that. We have studied this all in the anatomy first year, but this, as we are seeing this as a part of the neurological examinations. Now this is the dermatomes. Okay, so the dermatomes carries the major important part in the sensory assessment. Okay, so dermatomes, the function of this dermatomes is to perceive the impulses or perceive the stimulus from the surrounding. Okay, so there are some set dermatomes in the body according to the spinal nerves. Okay, and these spinal nerves carries the impulses from the similar dermatomes bilaterally. So whenever we carry the sensory examinations, we need to assess the sensations according to the dermatome level wise. Okay, according to the dermatomes, we need to assess the sensations from like superiors. There are some cervical dermatomes, there are some thoracic dermatomes, then lumbar, and the coccygeal. Okay, so the nerves arises according to these parts, the cervical, thoracic, lumbar, etc. From these parts, there are the nerves which arises from these vertebrae and passes to the some levels in the body, okay, to the skin, okay, to the dermal levels, and from these dermatomal levels we carries the impulses or we carries the sensations from the surrounding, and these dermatomes passes through this sensory nerve system to the tract system to the CNS. Okay, this is the pathway. Now there are some sensory symptoms in the body. So first symptom we call as a dermatomal level as is dysesthesia. Okay, so what is called a dysesthesia? It is the sensory symptoms described by the patient as a abnormal, painful sensations. like induced by the light touch. So whenever these are some abnormal terms, okay, so whenever we feel the patient is feeling the touch, that time patient will be seeing as a abnormal painful sensations, okay. So this is called as a dysesthesia, okay. The next term is paresthesia. What is meant by paresthesia? It is an unusual sensations which may be described as pricking, tingling, numbness, which is spontaneous in origin. Okay, this is called as a paresthesia. Then anesthesia. Like this is an anesthesia is a impairment or the loss of all forms of sensibility. Okay, the all sensations will be lost. It can be light, moderate, or total anesthesia. Okay, when there will be loss of tactile sense, termed as a tactile anesthesia. So whenever the patient is not feeling the tactile sensation, this is called a tactile anesthesia. Okay, when there is a loss of pain sensations, patient is not feeling the pain, that is called analgesia. Okay, as we are using the analgesics in the medicine. Okay, so analgesia is patient is not feeling the perception of pain. So only the pain perceiving pathway is getting blocked with this. Okay, or patient is not feeling the pain pathologically. Okay, so there is whenever there is a loss of pain sensations, we called as a analgesia. Then when there is a loss of temperature sense, term use is a thermoanesthesia. When patient is not feeling the thermal sensation, that is called as a thermoanesthesia. Now the next term is hyperesthesia. What is meant by hyperesthesia? It is an exaggerated perception of sensations. So whatever the perception patient is feeling, or whatever the perception or whatever the tactile sensations patient is feeling, are exaggerated in the forms. Okay, so these are not normal sensations. Patient is feeling excessive sensations or excessive perceptions. Okay, this is called an hyperesthesia. Then again next term is hyperpathia. Okay, it is a painful stimulus, evokes an intense pain or reaction much greater than the normal. So this is the intense pain sensations. Patient is feeling intense pain. Okay, this is called as a hyperpathia. Then there is another term is root pains. Okay, in some disease processes involving the root fibers may induce the spontaneous severe pain, often in cutting, throbbing, or tearing in nature. Okay, like such pains are present in the early stages when the damage is minimal and projected to the periphery, to the area of skin in which the sensory end organ and the irritates the fiber are situated. Okay, this is called as the root pain. So basically the pain which is carrying from the roots of the nerve endings, this is called as a root pain. Then the dissociated anesthesia. It means the loss of pain and temperature sense with the preservation of touch and the other forms of sensations. Okay, so only the touch and like pain, like preservation of touch and other forms of sensation, and there will be only the loss of pain and temperature sense. That is mean some sensory part is intact and some sensory nerves are like hampered. So dissociated. Okay, disassociated. So only the loss of pain and temperature sense will be loss of pain, and there is a preservation of the touch and the other forms of other sensations are intact. Now, how to assess the exam or how to perform the examination of the sensations? There are some set rules of the sensory examinations. Okay, so sensory examinations will be, the examination of the sensory system is very difficult part of whole neurological examinations. Why? Because it depends on the patient's interpretation over the stimulus given, and standardizations cannot be done for their response. What does this mean? See, basically whenever we are performing the examinations, the sensory examinations, we cannot measure it. Okay, the one person suppose the pulse rate. Okay, the pulse rate in the patients, we can measure the pulse rate. Okay, that like x beats per minute, that is we can measure and we can standardize it. That is like some 70 beats, 70 to 100, like 70 to 80 beats per minute will be the normal. This is the standardization of the pulse rate. Okay, but here, as this is a qualitative assessment, okay, this is not a quantitative. Sensory examination is a qualitative assessment, and the pulse rate is the quantitative assessment. Okay, we can set with the some example, and we can normalize or we can standardize the this. But in the sensory examination, is as it is a qualitative examination, we cannot standardize it. Okay, the entire sensory assessment is totally depend on how the patient is perceiving the pain. Okay, how patient perceiving, and we cannot say that the one person feeling the same sensations is feeling the same sensations with the other patient. Okay, so the person to person, this cannot be standardized. Okay, this can be vary from person to person, or as it is in the patient's control. Okay, sensory examinations, patient may say, if the patient patient is not properly oriented or the patient is not cooperative, patient may refuse to perform an sensory examination, or he may give wrong answers while performing the sensory examination. So we cannot say or we cannot standardize it. Okay, this is the main set rule for the sensory examinations. So it is the difficult part of the sensory examinations. So every time it is not possible that we can get the same answers from the same person. It is depend on patient's mood, patient's irritability, or the patient's perception, or the surroundings. There are some so many things which are matter while performing the sensory examination. So we cannot standardize it for the everyone. Okay, this is the difficult part of the sensory examination. Now second part is, before beginning, patient should be explained the exact nature of the test and carefully instructed to what he is supposed to do. Okay, as this is the difficulty, we can perform it with the difficulty. We need to tell the patient what exactly we are going to perform. Okay, so understanding the nature of assessment is very important for the patient. Okay, how patient has to react or how patient has to answer, that understanding should be properly performed. Okay, so we need to carefully begin with the patient. We need to explain the nature of the examination properly. Care must be taken not to tire the patients by many suggestions. Okay, so it should be, you have to tell exactly what we have to do. Don't give so many suggestions. Don't talk continuously with the patients. Don't irritate the patients. Okay, so don't tire the patients by giving many suggestions. Patient may get irritated and patient's mind may get tired, and this may affect on the sensory examination system or sensory examination perception maybe. So we should be take care that we have to explain the procedure, test procedure properly to the patient, and do not give the over suggestions. Okay, with the exact some words, few words, explain the nature of the test, and patient has to perform it properly. In order to ensure the accuracy, the patient's eyes should be closed. Okay, why we need to close the eyes? As whenever we are performing the test, as it is a perception matters. Okay, what happens is, whenever the patient is having an open eye, if we are performing the test with the open eyes, what happens? The surrounding may affect on the test procedure. Okay, there are the surrounding stimulus which are like patient may see something or patient may get distracted with something. Okay, so patient's eyes should be closed to avoid the distractions in the test procedure. Okay, and whenever we close the eyes, patient can get concentrate on the test procedure and on the perception procedure. Okay, perceptions are more can be realized with the closed eyes. Okay, as it doesn't the patient is doesn't getting distracted with the open eyes. Okay, as in the open eyes. So this is the next set rule. Patient is instructed to make his response prompt as soon as the stimulus provided by the uttering the word say yes. Otherwise, the phenomenon of delayed response, which indicate a delayed conduction, may be overchecked. So what happens? Patient has to instruct that patient has to say immediately whenever, as soon as he get the stimulus. Okay, so he has to say yes whenever he get the stimulus or whenever he perceive the stimulus. If patient is not properly understanding, we have to tell them how to give the answer. So patient needs to be very prompt while giving an answers, and he has to say immediately yes. Otherwise, there is a called phenomenon of delayed response. What happens in that is patient, there is some pathological changes in the nerve conduction, and if the patient is perceiving the late response, there is something pathological changes in the nervous system, and which indicates that there is a delayed conduction of the sensations. Okay, so patient has to be very prompt and very quick while answering yes. Okay. The time elapses between the stimulus and the response in the normal condition is 1/10 of the second, and in the disease state it may be as long as 10 seconds. Okay, so delayed conduction, how like time lapse between the patient. Suppose we are performing the test. Okay, patient is if we are touching, we are giving a tactile localized or tactile stimulus to the patient, and patient is saying yes. Okay, if it is patient is taking more than 10 seconds to say and yes, okay, or a patient is feeling yes, I'm feeling the sensations, that's it. So if patient is taking more than 10 seconds in this is called a delayed conduction. This can be concluded as a delayed conduction, or we can clinically diagnose as patient is having the delayed conduction. So the test procedure and the test response, it should not be carry more than 10-second gap. Okay, if it is more than 10 seconds gap, it is a delayed conduction, we can declare. In any circumstances, the patient must not be asked as, do you feel that, when the stimulus is applied. Okay, so what happens is, because of the social stigma, if we are asking the patient, if you are touching and if you are asking, do you feel this, do you feel this, what happens? Because of the social stigma, patient may say yes, yes, if patient is not feeling, but patient may say yes, I am feeling the sensations. Okay, because of the fear, because of the stigma, patient is not feeling, but still he can say yes, I am feeling. Okay, so you should, whenever you just say the procedure to the patient and just perform the procedure. Like if you are taking a tactile sensations, touch the patient's skin, and patient just, whenever he is feeling the touch, patient has to say yes. Okay, so you should not ask that, do you feel this, do you feel this. Okay, so you have to perform it like this. Every test carries out bilaterally on all over body. As we know that the dermatomal levels are bilaterally situated, we need to carry the procedure dermatome wise. Okay, it's like so we have to carry the test bilaterally symmetrical. Okay, left side, right side, left side, right side. This way you have to carry the test procedure. If the results are inconsistent of doubtful, then it may be necessary to examine the sensory examination number of times. Okay, suppose you are taking the examination and you are feeling that patient is not answering properly, or you are not getting a proper response from the patient. You have to take the examination number of times, or you have to ask some other physiotherapist or some other the similar person as you have educated. The same qualified person needs to perform the same test, and then you need to compare the test results. Okay, like this way you have to carry the number of times, as this is the totally depend on the patient perception and we cannot standardize it. That's why if you're now not happy with the test procedure, then you need to carry out again. Okay, In semi-conscious patients, the response to the painful stimulus can be assessed by the form of winging, facial grimace, or the limb withdrawal. So how to carry out the sensory examination in the coma patient or semi-conscious patient? As patient is not answering you, okay, that time what we have to do is we can perform the pain sensations. Okay, now how to examine these pain sensations? Whenever you are taking pricking the pin and taking the examinations, what happens? Patient will make a face patient will feel the pain like winging, or patient will do the facial expressions, or patient may withdraw the particular limb. Okay, this way we can able to answer that this patient is having the pain stimulus, patient is responding to pain stimulus or not. Now there are main three types of sensations. Basically we call it as a superficial sensations, or the other name for this is exteroceptive sensory examinations or exteroceptive sensations. What include in that? In that there are one is touch sensations, or we can call it as a tactile sensations. These are tested with the wisp of cotton, wool, or soft paint brush touched lightly to the skin, and patient is instructed to say yes immediately when he feels the touch. Okay. Now this is the touch sensations or tactile sensations. Take a cotton wisp and touch the dermatome of the particular dermatome of the patients wherever you want to perform the test procedure, and patient has to say immediately yes whenever he is feeling the touch. The next is pressure sensations. Okay, the next type in the exteroceptive sensations. It is a light pressure perception test with the head of the pin or back of the pen or pencil. So any blunt object we need to take and we need to apply a light pressure on the patient's skin. Okay, whenever the patient feels the pressure, patient has to say yes. Next test is pain perception. Okay, it is tested with the pin prick. The prick should be hard enough to elicit an unpleasant sensations. Okay, so this procedure is take a safety pin or any pin, pointed pin, and elicitate a response, perform the test or prick the patient's skin. This prick is hard, it should be hard enough that patient should feel unpleasant sensations. Okay, so patient will be seeing the unpleasant sensations, and whenever he feels the unpleasant sensations, then patient has to say yes. Then next is temperature sensations. It is tested with the two test tubes filled with the warm water and cold water, and patient has to say whether whenever the stimulus gets, the patient has to say it is cold or hot. So this is one important rule in the testing sensory temperature assessment is take a test tubes, okay, one filled with the warm water, one filled with the cold water, okay, and you touch the either warm or the cold water. You touch the patient's skin, and whatever the patient is feeling, if you are touching warm water and patient is feeling it warm, patient has to say warm. Okay, if you are touching the cold water test tube and patient is feeling cold, then patient has to say cold. Okay, and there might be chance that patient is feeling nothing, neither cold neither warm. Patient may feel as a normal water, or patient may feel warm as a cold and cold as a warm. Okay, so you just have to perform the test, and patient has to say warm or a cold. Now next examination is proprioceptive sensory examinations. Okay, there are three types in this proprioceptive examinations. First is joint position sense. Slow passive movements are carried out by examiner and ask the patient to say in which direction motion takes place, and tested bilaterally with each joint. Okay, when the patient can able to speak, okay, this joint position sense is proprioception, functioning of the proprioception properly or not. So function of the proprioceptors are joint position sense. So basically what we have to do is we perform any movement in the body. Suppose we are performing the elbow flexion in the patient. Then patient has to say, you have performed elbow flexion of my right limb. If patient is not able to answer it, he has to perform the same movement to the other limb. Okay, suppose you have folded his right elbow, then patient has to perform the same test. He has to fold the left elbow. Okay, the similar movement he has to perform on the other hand or the other limb. Okay, so we have to test it bilaterally. Okay, first right hand and left hand, then left hand and the right leg. Patient has to say the movements, or patient has to perform the similar movement to the bilaterally other side. Okay, this is a two methods in that. The next test is deep pressure pain. It can be elicited by either applying strong pressure or by pinching the muscles of the forearm, thigh, calf or the tenoachilles. Okay, so this is the deep pressure pain. We have seen the light pressure pain in the tactile sensations or the exteroceptive sensations. Now this is a deep pressure pain is a function of the proprioceptors. Okay, so we have to pinch the muscle bulk. Okay, deeply we apply a pressure and we have to pinch the muscle bulk or the tendon, and then patient has to say whenever he feels the pressure. Okay. Next is vibration sense. It is a particular value in the diagnosis of disease of the posterior column. Okay, it must be first it has to be demonstrated by the pressing base of the tuning fork on the sternum, both during vibrations and after the cessation of vibrations. Patient is asked to say yes whenever he feels the vibration and has to say no whenever he feels only the pressure and not the vibrations. Then close the eyes of the patient and vibration sense is tested on any bony prominences like big toe, malleoli, tibialis, tuberculosis or elbow, etc. So firstly we have to perform a test procedure. Okay, to understand the patient, the difference between vibration sense and the pressure sense. Okay, so take a tuning fork. With this test procedure we have to carry out with the open eyes. Okay, take a tuning fork, bang it and keep it on the head on the sternum. Okay, now patient has to feel the difference between vibration and the pressure. Okay, so patient has to say yes when he is feeling the vibration. Why on the sternum? As it is a very thin bone and vibrations can be felt very prominently on the sternum. That's why we are testing the test procedure. To understand the difference between vibration and the pressure, we have to test it on the sternum. So take a tuning fork, bang it, keep it on the sternum, and patient has to say yes when he is feeling the vibrations, and when the vibrations slowly get stopped, he has to say no when vibration stops, and only the pressure of the tuning fork is continued on the sternum. Okay, so he has to say yes when he is feeling the vibrations, and he has to say no when vibrations get stopped and only pressure he has feeling. Okay, this is the test procedure to understand. Okay, then now perform the test by closed eyes. Take a tuning fork, bang it and keep it on the any bony prominences of the joint. Okay, and this way we have to same carry the vibration sense examinations. These are all about the proprioceptive examinations. Now the third type of sensory examination is cortical sensory examinations, or we can call it as a combined cortical sensations. Okay, first test in that is stereognosis. Stereognosis is the ability to identify an object placed in the hand of the patient with closed eyes. Ask the patient to close the eyes and place the small objects in the hand such as a coin, button, key, and ask to identify the object. If he is unable to name them, then ask to describe the object with the size, shape or texture. Test must be carried out simultaneously with both the hands using the same object. Now, this is the stereognosis is the ability to understand the object placed in the hand, identification of the object. Take any small object, okay, like coins, buttons. Ask the patient to close the eyes and keep the object in the hand and ask the patient to perform the test. Okay, ask the patient to recognize the object. If patient is not able to understand what object is placed in the hand, then he has to describe the texture of the object, okay, or the feeling of the object. Okay, now take the same object, keep it in the other hand and perform the same test to the other hand. Now next test is barognosis. Okay, barognosis is the ability to detect the weight differences tested by using two coins or two different weights but equal and nearly equal size and the equal size and shape. The place the coin on both the hands with patient's eyes closed and then ask the patient to identify which is heavier. So take two coins with the different weight but with the same size. Okay, you can take coins or you can take small stones with the different weights. Keep the different weights on the two hands and ask the patient to identify which is heavier object. Okay, perform the test with the other hand. Okay, perform the same bilaterally equally. Third test is graphesthesia. It is the ability to identify the figure or number drawn on the skin with closed eyes. Write a number or draw a figure with a blunt point on the skin surface and the patient has to recognize it. So like stimulus should be sufficient size, not written too rapidly. This is the identification of the figure or the number drawn on the skin. We can draw like small numbers, we can draw alphabets, okay, or we can draw simple shapes. Okay, the shape should be simple and should be slowly written on the skin so that patient can able to recognize it, patient can able to understand it. Next test is 2-point discrimination. This is tested simultaneously touching areas of the skin with two different points with compass. Patient with eyes closed, the points are placed on the skin sufficiently wide apart to recognize 2 points and then gradually brought together unless the patient reports that single point only. The minimum distance between the 2 points that is appropriate as the double contact by the patient is noted. So take a compass and first take 2 points on the skin, keep it on the skin. Patient has to answer 2 points. Then reduce the distance between the compass, again test it. You need to perform the test, you need to keep reducing the distance until that distance when the patient is feeling 2 point as a 1 point. Measure that distance and document it. Okay, this way we need to understand we need to test the 2-point discrimination test. Next is tactile localization. It is tested by touching the skin with the pencil or fingertip with the patient's closed eyes and ask him to put a finger on some point and touch, and any error more than 2 inches is usually abnormal. So what we need to do is ask the patient, take tactile, there is a difference between tactile sensation and tactile localization. Tactile sensations comes in the tactile or the exteroceptive sensory examinations. This is a tactile localizations. Here, wherever we are touching the patients on which dermatome or which level, patient has to localize it. Okay, and there should not be more than 2-inch difference in this. Okay, if there is a 2-inch difference between the actual tactile touch and the localization, then there is something abnormal in the sensory examination or sensory system of the patient. So patient has to localize where we have touched the sensory or where we have touched the patient's skin. Okay, this is called a tactile localization. Okay, so we have seen today the sensory examination system. Okay, we have seen the examination, how to examine the rules, and there are some set rules how to take a proper assessment of sensory examinations. Then we have seen the spinal cord tracts. We need to by heart the tracts, which impulses carries through the which tract system to the CNS. Okay, then dermatomally level we need to perform the test procedure bilaterally equally or bilaterally symmetrically. Okay, and then we have seen the which are the types of sensations. We have seen first type of sensation is exteroceptive sensations or tactile sensations. In that we have seen the pain sensations, pressure sensations, touch sensation and temperature sensations. Okay, then in next is proprioceptive sensory examinations. In that we have seen the tactile we have seen first is joint position sense, vibration sense. Okay, and one more is deep pressure pain we have seen. Okay, and next is cortical sensations. We have seen stereognosis, barognosis, graphesthesia, 2-point discrimination and tactile localization. Okay, these are the types of sensory examinations. Now we will see how to make a sensory kit. Okay, to perform this some sensory examination, we need to make an own sensory kit. Okay, which we have to carry with ourselves whenever we are performing the clinical examination or the clinical sensory examinations. So what it should be, okay, what it should contains. Okay, for touch sensations we need cotton, wool or soft paint brush. Okay, take a box, take any empty box and make a kit, sensory kit, make your own sensory kit. Okay, so for touch sensation put the cotton in the wool or the soft paint brush you can perform. Then for pressure sensations use pen, pencil, okay, any blunt object you can keep. For pain sensations put a safety pin or small pin. Then for temperature sensation assessment, we need 2 test tubes. Okay. Then for stereognosis, put some small objects like coins, buttons, cloths, different cloths with the different textures. Okay, you can put for the stereognosis. Then for barognosis, you can use 2 coins with the different weights. Okay, but the same size. Or we can use the small stones with the different weights. But it should be with the different size. Okay, and for 2-point discrimination we need a compass with 2 points. Okay, these are all things we need for the sensory kit. You can make an kit innovative by thinking and by your own innovations. You can use it and you can perform it with with your imaginations and your innovations you can make an best sensory kit for you. So this is all about the sensory examinations. I hope you all have understand. If you have any questions you can directly contact me. Thank you.